Katie. I'm a PA student here to do your assessment. Just going to wash my hands. I'm first going to assess your appearance, your level of consciousness, your emotional state, any signs of pain or distress, and your health and your hygiene. Okay, so next we're going to do some vitals. I'm going to start with your blood pressure. You use your right arm. (118 over 60 is your blood pressure. Relax your arm. Next, I'm going to check your heart rate. Your heart rate is 78. Next, I'm going to check your respirations. And your respirations were 18. And I would check your pulse ox and your temperature. And I'll do your BMI next. How tall are you?
6'1".
And how much do you weigh?
190.
Okay. So next I'm going to assess your skin, noting the color, any moles, nevi or lesions, looking at your back, your chest, and your abdomen, and your legs. Okay, I'm going to then palpate your skin for temperature, texture, moisture, and turgor, and your legs as well. Next, I'm going to assess your hair. I'm going to assess your scalp, your hairline, and behind your ears. As well as palpating the hair for texture, distribution, and quality and quantity. Next, I'm going to assess the nails and the toes, as well as palpating for texture and doing capillary refill. As well as looking in between the toes for any lesions. Next, I'm going to assess the head as well as palpate the head. Palpating the temporal arteries. Palpating the parotid gland, as well as the maxillary sinuses and the frontal sinuses. Next, I'm going to assess the eyes. I'm going to assess the external eyes, the eyebrows, the eyelids, and the lacrimal apparatus, as well as the inner eyes, the sclera, the conjunctiva, the iris, and the pupil. I'm going to first just note the size of the pupil in the light. Okay. and then the pupil reaction with direct and consensual light. Direct first, and then consensual. As well as the other eye, direct and consensual. Next, I'm going to do accommodation. So I'm just going to have you look at the pen light as I move it away from your face and towards your face. Noting both eyes. Next, I'm going to do the corneal light reflex. You can just look straight ahead. I'm going to shine this light on your nose. Good. Okay. Next, I'm going to check ocular eye movements. Just follow my pen light and don't move your head. Thank you. Next, I'm going to check a visual acuity. Do you wear any glasses or contacts?
No.
Okay. I'm going to have you hold this out at arm's length reach and cover one of your eyes, then the other, then both eyes. Read the lowest line possible.
D-E-F-P-O-T-E-C.
Good. That was 20/20 in your left eye.
D-E-F-P-O-T-E-C.
Good. That was 20/20 in your right eye. Now both eyes.
D-E-F-P-O-T-E-C.
Good. That was 20/20 with both eyes. Thank you. Okay. So next, I'm just going to check your visual field. So I'll have you cover again one of your eyes, and I'll do the same. Tell me what number I'm holding up.
2, 2, 1, 1.
And then the other eye.
2, 1, 1, 2.
Good. Next, I'm going to do a fundoscopy exam. I'm just going to be assessing your eyes. Let me know if the light gets too bright. Just checking for a red reflex. Good. And then I'm going to do the other eye. Good. Next, I'm going to assess your ears. So first, I'm just going to assess the external ears, as well as do the tug test. Do you have any pain when I tug on your ear?
No.
And bilaterally, as well as assessing the external ear. Next, I'm going to look inside the ear, into the ear canal and the tympanic membrane. And the other ear. And next, I'm going to perform the whisper test. So I'm just going to make a noise in your ear, and you just raise your hand when you hear that. Close your eyes. Good. 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 Thank you. So next, I'm just going to assess the nose. I'm going to assess the external nose, and then the internal nose. I'm going to have you just tilt your head backwards as I look inside. Good. And the other side. Good. Next, I'm going to assess patency of your nose. So I'm just going to have you occlude one of your nostrils. Take a deep breath in and out, and let me know if you're able to breathe through that nose.
Yes.
Okay, and then the other side.
Yes.
Okay. So next, I'm going to assess the mouth, the lips, the mucosa. Are you able to turn your lips inside out like this? Good. And then I'm going to assess the teeth and the gums. Can you smile for me? Good. Next, I'm going to assess the palate, the uvula, and the pharynx. I'm just going to shine some light in here, and I'm going to have you stick out your tongue and say, ah. Good. And then next, I'm going to just assess your tongue. Can you stick out your tongue? Good. Can you move it side to side? Up. Up. Can you say ah? Noting the salivary glands. Good. So next I'm going to do the neck. I'm just going to assess the muscles in the neck, the greater vessels, the trachea, and the thyroid, as well as palpate the muscles, the greater vessels, the trachea. And then to palpate your thyroid, I'm going to step behind you and place my hands around your neck, okay? Good, and can you swallow for me? Good. Next, I'm going to assess your lymph nodes, your submental, your submandibular, your tonsils, your preauricular, your postauricular, your occipital, your posterior cervical, your deep cervical, and your anterior cervical, as well as your suprasternal, okay, so next I'm just going to assess the chest, noting the color, the respiratory rate, depth, and effort, the chest wall, the contour, shape, and chest wall expansion. Good. I'm going to have you turn around in your chair. A little bit more. Good. I'm first going to begin by palpating 4 different areas. Next, I'm going to do tactile fermentus in those 4 areas as well. And every time I touch you, you'll say blue balloon.
Blue balloon. Blue balloon. Blue balloon. Blue balloon.
Good. And next I'm going to percuss in 7 different areas. And then I'm going to auscultate in the same 7 areas. And I would have you put your arms up as I'm doing so. Good. Every time my stethoscope touches you, take a deep breath in through your mouth and out through your mouth. Okay, then I'm gonna have you turn around. Now I'm going to palpate in 3 different areas. And then I'm going to do tactile fermentus again in the 3 areas, and you just say blue balloon every time I touch you.
Blue balloon. Blue balloon. Blue balloon.
Good. Next I'm going to do palpation in 6 different areas. And then I'm going to auscultate in the same 6 areas. Take a deep breath every time I touch you with my stethoscope. Okay, and that's all. Thank you.